Nacole Bradley. I'm a physical therapist with 16 years of experience, and I'm also board certified in orthopedics. As a follow-up to my video that you may have seen a few days ago on choosing the right type of shoe, I thought I would talk about plantar fasciitis. It's one of the most common problems that we as physical therapists see when we get a diagnosis of foot pain. So a lot of my patients have had this, a lot of my family, a lot of my friends have had this. You don't have to be a runner to have plantar fasciitis. If you've gone to the doctor with complaining of pain in the bottom of your foot, pain in your arch, you've probably heard the term plantar fasciitis. One thing to think about though, before you start doing these stretches is, do you truly have plantar fasciitis? If you have numbness and tingling in the bottom of your foot, you may want to go to a doctor or physical therapist and get your foot looked at first. You could have tarsal tunnel syndrome, you could have radiculopathy, which is maybe a pinched nerve coming from the back. You also may be having some signs of peripheral neuropathy. But if you've been wearing flip-flops a lot, if you've been walking around your house a lot without any shoes on, maybe you've started a new exercise program, whatever the change that there's been in your activity level, and now you're having pain in the bottom of your foot, pain on your heel and pain through your arch, chances are pretty good that you probably have plantar fasciitis. The majority of our patients with plantar fasciitis have tight gastroc and soleus muscles, and you're going to know those as your calf muscles. Those two large muscles in your lower leg come together to form your Achilles tendon, and they're going to shorten the range of motion that your ankle has. So when you're walking, if your ankle is stiff, you don't have proper range of motion, then your arch is going to collapse a lot more, and that's going to put strain onto your plantar ligaments. It's going to stretch the flexor digitorum brevis muscle beyond what it is used to, and stress some of the ligaments in the mid part of your foot. All of those things combined over a long period of time, wearing the improper shoe, poorly supporting shoe, or like I said, a change in activity level, can lead to inflammation in those plantar ligaments. It can lead to myofascial trigger points in the flexor digitorum brevis. It can lead to tendinitises in the posterior tibialis. That's another diagnosis that sometimes gets mistakenly called plantar fasciitis because it hurts in the bottom of the foot. But if you're just having pain in the bottom of the foot, or maybe you've been diagnosed with plantar fasciitis, try these stretches at home to see if they'll help. The first one you're going to do is your gastroc stretch. So you're going to be feeling the stretch here in this upper portion of your calf muscle. You're going to take a nice wide stance, and you're going to lunge forward onto that front leg, trying to keep the back heel down. With large muscle groups, with thick tendons like the Achilles, you're going to want to hold this stretch for at least 60 seconds. And then you're going to want to repeat that for about 5 times. We used to think that doing short, bouncing stretches like this was good. We now know that the longer, prolonged holds give us more lengthening of the tissue. So this first stretch is the gastroc stretch. A lot of people know this as a calf stretch. But there's another part to your calf muscle, and that's the soleus muscle. And that's the second part of this exercise. You're going to let your knee slightly bend, and you're going to feel that stretch move lower down into your lower leg in this area here. Still going to be feeling the pull in that Achilles tendon area, but the muscular part of the stretch is going to be less. In the higher part in your calf muscle, it's going to be a little bit lower. So those stretches both, you're going to want to do those for at least a minute hold and repeat 5 times if you can. Then you can take a racket ball like this. We use these in the clinic to teach patients self-myofascial release. You can also use this to relax that flexor digitorum brevis muscle. Just place it on the ground. Now I like to sit when I do this, but you can stand as well like I am for demonstration purposes, and just press into that ball. Then you can roll back and forth, and it kind of feels like a deep massage. Maybe sore, don't press it so hard to the point that it hurts. A little bit, some discomfort is fine, because you want to work through those tight, painful areas, but you don't want to press so hard that it is exceptionally painful. You also don't want to press so hard that you feel numbness and tingling or burning. Those are nerve sensations. And there are a lot of nerves and blood vessels in your foot, so you do want to be gentle. You don't want to stand up on the ball and put that much of your body weight through it. But this massage with this hard racket ball or any other type of myofascial ball or maybe even a tennis ball really gives the plantar fascia a nice little release. And if it is tight, then this kind of feels good. Some people also like to stretch their calves. You may have seen this before, where you put the toes up against the wall and then bend into it. And that's an okay stretch as well. I don't usually recommend that you put the toes on the step and drop off the step. If you're inflamed and you're painful, sometimes that stretch can be a little too aggressive. So you can moderate your stretch and keep it in that less painful range if you will start with the standing positions here, knee straight, knee bent, and then if you want to do the one on the wall, you can do that as well. Engage that plantar fascia and that gastroc and soleus muscle from those positions as well. But be cautious about dropping your heel off the step. Sometimes that can be a little too aggressive. Ice is another good thing for plantar fasciitis. And remember, you definitely want to be in the right type of shoe for your foot structure and your gait pattern. That way your plantar ligaments are properly supported. So I hope you find this information helpful, and good luck in treating that plantar fasciitis at home.